Hello, I am Sarah McLeod, your host for Proven Cures. Today is Wednesday, April 10th, 2019. I am actually in a rush. I'm about to run into work. I'm starting my day, but I just really wanted to get this video series started for all of the people who are suffering from pulmonary fibrosis or know someone who is suffering from pulmonary fibrosis, and they really want to hear of the latest research and alternative therapy. Maybe their doctors don't even know about the FDA approved drugs that came out in 2017. Maybe they're not able to try them because some people have been getting a lot of benefit from their use. Maybe because of the side effects, they're not able to take them. They do, especially prednisone, cause elevated liver enzymes, which can lead to, severe liver disease. One of them it's the nintedanib, if I'm saying that correctly. I see that it causes bruising and bleeding, can cause hematomas. So a lot of people are not comfortable taking those drugs. Also, there's some people who are just basically waiting to get a lung transplant. I see that the fatality prognosis is very high for people who are diagnosed with pulmonary fibrosis. It even hurts me just to say it out loud. And I'm so sorry for your suffering. Actually, people are being diagnosed and told that they may only have 2 to 5 more years to live. If you are tuning in because of my IG posts, my Instagram posts, first of all, my IG name is proven_cures if you want to follow me there. Sometimes I'll post things that are not related to Proven Cures at all. So that's why I don't really push my social media account. I'll post all kinds of foolishness, sometimes music, whatever, or something I just might be going through the day and thinking about, just stuff that's irrelevant. But a lot of people are coming by this video because of my IG post, in which I posted that I'd found research that was discovered and published in July of 2018 showing that metformin was actually able to stop the progression of pulmonary fibrosis, basically stop the scarring in the lungs. The thing is, that study was conducted in, I believe, rabbits or some kind of rodent. So I did some follow-up research because I'm never comfortable with animal research, and this is the reason why. When I did the follow-up research showed that people who were able to get a prescription, an off-label prescription for metformin, on-label means that the indications on a drug label, like an indication is saying what a drug is used for. So that's what we call on-label use. So metformin has an on-label use as a hypoglycemic. It is prescribed to diabetics to keep their blood sugars under control. So if you have pulmonary fibrosis and you were able to get a prescription for it to treat the scarring of the lungs, then that would be considered an off-label use. So people who were able to get a prescription for off-label use actually were disappointed because what was found was that metformin stayed localized in the gut and did not make it to the lungs, so they weren't able to benefit from taking it. It is now being recommended by researchers that metformin be manufactured as an inhalant so that it can reach the lungs and actually help people who have pulmonary fibrosis. But I'm not going to belabor that here. I would like for you to write down the words. Did I tell you this already? Because I filmed this is my second filming of this video, so I'm a little spacey. I was driving at first and there was a lot of background noise, so that's why I'm filming this again. So I don't know if I told you already to write down these 2 words, Cordyceps sinensis. That is what this video is going to be about. CORDYCEPS, sinensis, SINENSIS. Cordyceps sinensis is actually a component of traditional Chinese medicine, and it was tested in China. Actually, have the study here in my hand. It is titled Effects of Feiwei Granules in the Treatment of Idiopathic Pulmonary Fibrosis, a Randomized and Placebo-Controlled Trial. That lets you know right there that this was tested in human beings. It was actually published in the Journal of Traditional Chinese Medicine on August 2015 of 2016. Okay, if you actually want to go look it up for yourself. I don't know if you can really see that properly, but I'm going to post this in the summary of this video on YouTube. Okay, and I'm going to go over this in part 2 of this video series. But I just wanted to touch on the disease itself. If you're wondering exactly what pulmonary fibrosis is, sometimes we're diagnosed with things and we're not truly aware of what they are. It is actually a lung disease that occurs when lung tissue becomes damaged and scarred. And you might be wondering, how does my lung tissue become damaged and scarred? Well, a lot of people have precluding infections. Maybe they had bronchitis at one time, asthma, pneumonia, those kinds of things, and the lung tissue becomes damaged with continually trying to get rid of excess fluid on the lungs and so forth. And after a while, the scarred tissue becomes stiff, which makes it more difficult for the lungs to function, right, to expand and contract properly. And as the condition worsens, sufferers become progressively more and more short of breath. Symptoms of pulmonary fibrosis includes, like I said, shortness of breath, also a dry cough, feeling tired all the time, unexplained weight loss, aching in the muscles and joints, and actually clubbing, widening and rounding of the tips of the fingers and or toes. Okay, the course of pulmonary fibrosis and the severity of symptoms vary from person to person. Some people become ill very quickly with severe disease, while others have moderate symptoms that tend to worsen more slowly over the years. Some people may experience a rapid worsening of their symptoms, such as severe shortness of breath that may last for several days to a few weeks, while others have acute exacerbations, may be placed on a mechanical ventilator. Doctors are known to prescribe antibiotics, corticosteroid medications to treat these acute exacerbations. Okay. Also, in addition to breathing treatment, there were 2 drugs that came out on the market in 2017. One is called Prednisone, and another is called nintedanib, Nintedanib. Prednisone is spelled Pirfenidone. So if your doctor has not brought these to your attention, you can bring these to your doctor's attention as well. I don't share research and expect people to listen to me and just run out and do as the research protocol suggests. These are suggestions. This is just information, something that you can use to your benefit in the long run. However, if you don't want to try the Cordyceps sinensis after I tell you all about it in the next video, you can also try these FDA approved drugs as well. You know, let your doctor know if your doctor hasn't let you know. Okay, and thank you for tuning in. This is part 1. I'm going to try and get it uploaded today. YouTube has been giving us YouTube uploaders a hard time recently. My last video took like 6 hours to upload for some strange reason. It's been going on since March. It's not just me. A lot of people who are YouTube posters have been complaining. Think of something else I wanted to say before I go. Also, with Cordyceps sinensis, it was found it does not raise liver enzymes, so it is actually safe for your liver. It is actually a prescribed treatment for chronic kidney disease, so it has dual purposes. It, as far as the side effects for Cordyceps sinensis, some people suffered diarrhea, and it can increase bleeding risk. So if you are scheduled for any kind of surgery, you would want to stop taking it 2 weeks prior to your scheduled surgery. But those are the side effects. So yeah, so for part 2, I'm going to review the study with you and let you know how it panned out for the study participants who came in with pulmonary fibrosis and were given a course of the Cordyceps sinensis. And thank you so much for tuning in. Look out for part 2. Thank you.